Let's talk about aldosterone, the hormone that's basically the body's water manager. If you don't understand this guy, all those cardiac meds and fluid balance questions are going to feel like foreign language. I have a visual in the link in my bio that goes over the RAS system, and it breaks down also how aldosterone works. So go check that out. So aldosterone is a hormone made by your adrenal glands. Those are little hats that sit on the top of your kidneys. That's how I think of them because I think that's cute. It tells your kidneys, hey, hold on to sodium and water, and while you're at it, go ahead and dump that potassium. So when aldosterone is high, your blood pressure is going to go up, your blood volume is going to go up, and the potassium is going to go down. Now, when do your kidneys ask for more aldosterone? This is literally how the RAS system works. It's whenever they notice low blood pressure. So if you are bleeding, if you're dehydrated, or if your overall volume is low. Also low sodium, because sodium is key for holding on to water. Wherever sodium goes, water flows. And that's when your kidneys are going to release renin. So renin isn't raising blood pressure by itself. It is the starter gun in the RAS system. I have a whole video over just doing a quick little refresh. The kidneys are going to release renin. Renin converts angiotensinogen, which is a protein from your liver, into angiotensin 1. Then ACE, the angiotensin converting enzyme, changes angiotensin 1 into angiotensin 2. Angiotensin 2 is the heavy hitter. It is what is going to tighten your blood vessels and tell your adrenal glands to release aldosterone. But why does aldosterone matter in your body? So it keeps your blood pressure stable so you don't faint every time that you stand up. Keeps you from getting dehydrated by holding on to water whenever your volume is low. It also balances potassium so your heart rhythm stays safe. So why do we care as nurses? When aldosterone is out of balance, you'll see it right away in your patients. Too much aldosterone, such as hyperaldosteronism, is going to have high blood pressure, fluid retention, but low potassium. Too little aldosterone, like Addison's disease, you're going to have low blood pressure, dehydration, and high potassium. When we give certain meds, we're either blocking aldosterone or changing how it works. The meds that mess with aldosterone are ACE inhibitors or ARBs. They block the RAS system, so less aldosterone, lower sodium and water, but now you're at a risk for hyperkalemia. Also spironolactone, which is a diuretic. It literally blocks aldosterone receptors, so that's going to lower blood pressure. It's going to spare some potassium, but then you're going to want to watch for the patient holding on to too much potassium. Another is loop diuretics like furosemide. It's going to cause you to dump sodium and water, so your body may crank up the RAS system to try and compensate for this.